Good morning, everybody. Good Sunday morning to you. I hope you're doing well this morning. My name is Dan Brady, one of the battalion chiefs here at Nature Coast EMS, and I'm going to give you a quick update from the EMS standpoint on COVID-19. Well, the big thing that was announced yesterday is the governor of Florida announced that schools will be closed and will be doing their distance learning for the rest of the year. It's been something everyone's been talking about, and it's just something that was finally decided upon. So now we know for the rest of the year, schools are not going to be open. So an update on staff members at Nature Coast EMS. Thankfully, none of our staff members have tested positive for COVID-19, though we have had many confirmed cases that we've transported. And we're really working hard to maintain that. We've actually seen a few new cases this week that we've transported. So folks, remember when you call 911, in many cases with this pandemic going on, you're going to see just one of our providers go in your house, assess the situation, as long as it's safe to do so, assess the situation and see what we need. The reason for that is that we're trying to minimize contact with any of the first responders with any potential cases. This goes for the fire department and law enforcement. We're trying to minimize, if at all possible, any unnecessary contacts with potential COVID-19 cases. Also, don't forget, in many cases, we're going to be wearing lots of extra personal protective equipment that we don't normally wear on a regular basis. So one of the questions that we get asked a lot, whether it's through Nature Coast EMS or in our personal lives, is what kind of calls are we seeing? I can tell you when this started, we saw a rise in overdose calls, a rise in cardiac arrests in younger folks. That kind of tapered off, and in the last few days I feel like we've seen more of that. We've seen a lot more overdoses. Yesterday during the day, I believe we had 8 overdoses early in the day, just during the daylight time. And we've also had a rise in single vehicle car accidents. So folks who are going out driving for whatever reason, lose control, get into an accident, just one vehicle involved. Had some last night, had several over the last few days, unfortunately many with fatalities. So when you go out there, if you have to go out, please be careful. Consider, do I really need to go on this trip? Do I really need to go on this outing? So please be careful on the roads out there. We've had many cases where the roads are wet, especially rural roads. That makes it very, very dangerous. The other night we had wet roads, foggy conditions, really, really dangerous stuff. So please be careful on the roads out there, folks. And again, do you really need to make that trip or not? Something that happened in the last few weeks for us is that we have air life back at Inverness Airport. So we have a helicopter a lot closer when we need it for trauma calls and for certain medical calls. So air life is back at Inverness Airport, which is pretty cool and definitely helps the citizens of Citrus County. So at Nature Coast EMS, we are constantly trying to improve how we take care of COVID-19 patients, how we keep ourselves and our trucks clean, and we are doing a few things that we wouldn't normally do. After every call, we always clean our ambulances. We sweep them down, we wipe them down with a sanitizer cleaner. But one thing we're doing is that if we have any potential cases for COVID-19, we have an aerosolized sanitized spray, and we open the cabinets, we open all the doors, and we spray it all down, and it particleizes it, and it gets in on any areas that are really, really hard to reach. Because this virus, it spreads through droplets. So if someone sneezes, if someone coughs, the virus can aerosolize in the ambulance, and it's really tough because it's a confined space. So we spray these things down, and hopefully gets in every corner and crevice and area that we may not be able to just hand spray or hand scrub very well. Another thing we're doing is at our headquarters, both of our main headquarter buildings, we have a little tray with some bleach water and some sanitized water that we step in our boots, because the last I saw, there's some difference in data, but this stuff can live on sneakers and boots, footwear for up to 5 days. And again, this information is always changing. So we're just trying to do use every precaution we can to make sure that we aren't tracking it around everywhere, because that's going to spread it. And again, thankfully, none of our team members, none of our staff have been positive for this thing. I want to thank a few companies, grocery stores, convenience stores, who are putting up some extra hours for healthcare workers and first responders, so we can go get groceries when they're not open to the public, and we can kind of get in and get out and do it quickly. So Publix, Walmart, Winn-Dixie, Sam's Club, are all making accommodations, which is really, really neat, and we want to just publicly thank those companies for doing that. So I want to thank so many other agencies and companies who have, you know, just come out and fed us and thanked us and appreciated us, and it really helps us because there's so much uncertainty in this stuff going on. So we really just appreciate that. I want to thank you guys for supporting us and just continuing to do so. All right, so lastly, I'm going to go over the statistics for the country and the state. And this is as of early this morning. I confirmed this stuff. So let's see here. In the country, we have 722,761 cases, and we have 68,285 who have recovered. We have 33,903 deaths in the country. That's about a 4% death rate as of right now for COVID-19. So in Florida, we've got 25,492 cases, 748 deaths. So for the state of Florida, it's about a 2.9% death rate. In the state of Florida, we have 3,745 hospitalized. That's about 14% of all COVID-19 cases in the state of Florida require hospitalization. So 14%, 1-4. Citrus County has 82 cases, and we have 8 deaths. So we're sitting at about a 9.7% death rate for the county. We've got 22 hospitalizations in Citrus County. So about 26% of all the cases that we have in Citrus County have required hospitalization. The age range for COVID-19 patients in Citrus County remains about 12 to 93 for the age groups, and this stuff is always changing. So every day it's going to change a little bit. Sumter County has 144 cases. Hernando County has 84 cases. Marion County has 118, and Levy County has 11. All right, folks, I want to take a second again to remind you guys to call 911 if you're having a true emergency. Many people have actually done this. We've seen call volume drop, and most of our cases are acute emergencies that are true emergencies, and the rest of them are, you know, respiratory calls, sick person calls, a lot of stuff that really could potentially be COVID-19 cases. So please remember, call 911 when it's a true emergency. Use the emergency room only when it's a true emergency. All right? If you can use telehealth at all, do it. Okay? If you can call your healthcare provider and they utilize telehealth, it's great because that minimizes your contact with the public, minimizes their contact with the public, and it keeps healthcare workers healthy and safe for a lot longer so we can take care of people. Folks, remember that the State Health Department has a COVID-19 call line, call center. Utilize that number. We have it to our Facebook page. It's at the pinned at the top. And so if you have any questions, you can check it out there. Utilize it. It's a resource that they've set up for everyone in the state of Florida to use and to stay healthy. I want to thank you all for supporting us at Nature Coast EMS. We are here. We're ready to serve the citizens of Citrus County. We're happy to do so, and we love the people we take care of. Thank you guys so much. Stay healthy. Take care of yourselves. Stay home as much as you can. Be safe when you do have to go out. All right, we'll see you guys later.